Tonight, more promising news for treating COVID-19 before someone gets incredibly sick. We first told you about the drug Bamlanivimab a month ago when it first was approved by the FDA. Now comes infusion options for people who have been diagnosed with COVID-19. It is what many health experts are hoping will be the first of what is likely to be multiple outpatient non-vaccine treatments. Andrea Blanchard is a supervisor for this BAM infusion that we're really focusing on today. Andrea, we've been hearing about this treatment for a couple of weeks now. It first came out, I think, toward the end of November as far as becoming more public and more known in the media. But for people who aren't really familiar with it, explain what this is and then what this infusion is.
Sure. So BAM, as we call it for short, is a monoclonal antibody infusion. And what that means is that it's man-made antibodies that are similar to those who have already had COVID-19 and what their bodies may have already produced. So the hopes of a BAM infusion with these man-made antibodies is to help reduce the amount of COVID-19 virus that's in your body. The goal for us with the BAM infusions is then to hopefully keep those who might end up being hospitalized from being in the hospital.
So people who have a greater risk at getting COVID-19 who haven't already had it are the folks that you're seeing for these infusions?
Yep. The group that we're targeting right now as being qualified for the BAM infusions are patients who have tested positive for COVID-19, have mild to moderate symptoms, and are at high risk with either underlying health conditions, comorbidities, and deemed eligible by their primary care provider.
How much does insurance, do you know? And insurance is such a sticky topic because healthcare professionals don't necessarily know about the insurance side of it. But as a consumer or as a patient, that's one of the first things I want to know. What's my cost with this going to be?
Sure, that's a question that I may not be able to help you with and maybe need to be directed to somebody else.
Okay, do you know though if insurance has covered this up to the point where, how long have you been doing these infusions and has insurance covered for other patients, do you know?
I don't know that answer. We've been doing these infusions for about 3 to 4 weeks, and I know that with it being an emergency use authorized drug, there are special stipulations that come into play as far as insurance is involved.
Okay, so people would have to check into that and also talk to their medical provider. Now, how come MercyOne seems to be on the cutting edge of this? I think it's fantastic, and I hadn't heard about any of these infusions with any of our other medical facilities around the area or even around the country.
Sure. Yeah, we're just really pushing to try to stay ahead of the spread. With the holidays coming up and going through the holiday season, we're really trying to do what we can to help keep our hospitals from being strained and try to keep people out of the hospital that don't need to be there. So we're really hoping that with these BAM infusions, we're able to keep people who may have been hospitalized before from getting to that point. So we're hopeful that this new breakthrough drug will help us accomplish that.
How are you doing in Mason City at the hospital there? We continue to talk about our hospital beds, the availability, our ICU rates. How are things with you all there?
Sure. I don't know what the current numbers are today. You can find that on the public health website.
Yeah, but just in general.
In general, we're doing okay. The numbers remain high, but we're seeing a downward trend right now, but we do have concerns with the holiday season, so we're just really asking people to continue to wear their masks, continue to practice good hand hygiene, do all the things you can to help us in the healthcare world and to help keep us and the community safe.
When I think of an infusion, Andrea, I'm thinking of a needle that sticks in somewhere and then something gets pumped in. Is that the same with this, or how is this, how do people get this?
Sure. So the infusion itself is given by the IV route. What happens is the patient comes in, it's about an hour infusion, and then we have an hour observation time afterwards just to make sure that the patient is doing okay, and that's a common standard practice for this type of medication with the monoclonal antibodies. And then once the patient is doing okay, we send them home. So it's about 3 hours from start to end.
Okay, and that sounds easy enough. So hopefully, as we talk more about it, people will seek this out a little bit more. The more coverage, the more protection from this virus, the better. Andrea, thank you.
Yeah.